IAMDBP. I work with children every day on complicated neurodevelopmental issues and complex behavioral problems. I do this in a private practice, and this organization allows me to get new ideas and new strategies that are being implemented all around the country. It gives me a connection, and it gives me a peer group, and it is my clinical home. I'm Damon Korb. I direct the Center for Development and Learning in Los Gatos, California. IAMDBP.
For me, DBP is about helping families and educators understand what difficulties the child is having and helping them advocate for services and supports for that child. Sarah Knipe, I am a developmental behavioral pediatrician at Children's Mercy in Kansas City. IAMDBP.
It's one of the best ways to assure the best outcomes for children in America. I'm a general pediatrician at the Mass General Hospital for Children and Harvard Medical School in Boston. I am DBP.
I am particularly excited about opportunities to grow integrated care and integrated behavioral health services for children and adolescents. I'm a clinical child and adolescent psychologist. My name is Terry Stanson, and I'm at Metro Health Medical Center in Cleveland, Ohio, and I am DBP.
So I work in teams all the time to take care of kids. And when I'm in a room full of physicians, I bring the mental health perspective. And when I'm in a room full of mental health professionals, I'm the pediatrician and I interpret the medical information. So in the end, I end up being the interpreter. When we work with families, we bring all those pieces together and we make it make sense for them. Jeff Yang, Children's Hospital, Los Angeles. I am DBP.
As a primary care pediatrician, which I did for 27 years, I could combine primary care with developmental and behavioral pediatrics. I'm Lenny Rappaport. I'm at Boston Children's Hospital, and I am DBP.
What I love about DBP and what really drew me to the field was that you get to live in this really cool space where you get to integrate medicine and psychology, psychiatry, neuroscience, neurobiology, neurology, public health, political science, advocacy, and it all comes together into this one big picture where all of a sudden you're surrounded by really cool people who are doing all of the same thing that you're doing, and that's really a special thing that I think we have going for us. It's Justin Schwartz. I'm at University of Alabama at Birmingham, and I am DBP.
I am passionate about developmental behavioral pediatrics and my work with children and families, where I draw from tools from general pediatrics, psychiatry, and psychology to deliver what I hope is optimal care and life-changing. I'm also passionate about working with education for undergraduates, medical students, residents, and fellows. I'm Barbour Felt, Michigan Medicine, and I am DBP.
I think one of the key things of developmental behavioral peds is that we have the time to talk with families and really listen to what they're concerned about. And then we also have the knowledge to help them navigate, help both the families and their primary care providers to find the resources and the things that are going to be really helpful for them and their children. I'm Bill Beechler. I work at the Riley Child Development Center at Riley Hospital for Children in Indianapolis, Indiana, and I am DBP.
I'm passionate about teaching providers, parents, and patients about what it means to develop as a full human being. My name is Karen Miller. I'm at the Center for Children with Special Needs at the Floating Hospital for Children at Tufts Medical Center in Boston. I am DBP.